Good afternoon. This is Dr. Bill Bird Chief Medical Officer at CGH Medical Center, joining you here for Facebook Live. So we're going to do a little something different today with Facebook Live. I'm going to give you some information about COVID and where we're at in the community as far as that goes, and a few things about that. And then actually what we're going to do is tee up a tour of our emergency department that I did this morning with our manager, Sarah Alvarez Brown, Dr. David Halsey, and then some of the emergency department team. Much like if you watched our behavioral health unit tour, something like that. So stick around after I get done here and you can check that out. I think you'll enjoy it. Okay, so getting to what's going on with COVID. And by the way, if you have questions, I'm only going to be on a little bit here, and then we can answer those via Facebook. So you can reach out through Facebook, and we won't be answering them live, but we can answer any questions that you have. So I'm going to be giving you some numbers about our numbers, but just so you know, our Facebook page now, it's going to be our COVID Facebook page is going to have our daily numbers in terms of hospitalizations here at CGH. And we're seeing what the rest of the country's seeing. The number of cases in the community and the number of patients, therefore, in the hospital are going up quite a bit. Nationwide, I was just looking in the past 2 weeks, the number of cases in the country are up 41%. And Whiteside County, Matt, you could probably throw those numbers up there. But what I looked at from yesterday, our positivity rate was 13.7%, and Illinois' positivity rate's more like 6.7%. So we're definitely there we go. There's some numbers. So yeah, the number of cases is definitely going up, and we know that. That's nothing. We know that. And if you look at the data in terms of the number of cases in our county, it's kind of like I'm doing a hard time with my hands, but it just starts going up like that, and that's where we're at right now, and it hasn't really plateaued from my perspective right now. We have, as of this morning, we had 16 patients on the surgical floor, which now we've converted it into a COVID unit. So every patient on that floor has COVID. There are 16 patients in that status, and we had 8 patients in the ICU this morning. So, and definitely using some vents and what are called BiPAP machines, which are positive pressure machines to help folks breathe. So it's the wave that we were concerned about in March, April, and May. It's now. It's now for us, and we're living through that. So our number of cases, we've tested 9,074 people here at CGH since this started. 874 have been positive. 8,049 have been negative. We're testing over 100 patients a day right now. Most of those are at Ready Care. And yeah, we're struggling. So we're struggling with a number of cases in the area, and that, of course, reflects on our employees are part of the area. So we're having some of our employees that are out with quarantining and being positive, and so that's a challenge for us as well. So far, we've been able to continue to have all the services that we normally provide, and we're going to try our best to continue that. I will say, as I've said before, in terms of our staff being out, the vast majority of the time, that's not related to the interactions that our staff have with patients and patients have with staff. So those moments, we are doing a really good job in keeping everybody safe. It's outside of those moments, where the tentacles of this pandemic are far-reaching. I would just throw in also, if you would, if you haven't had a flu shot, make sure to get one, please. That just takes that off the table in terms of less likely to have more issues with patients being sick and trying to figure out whether that's a flu or COVID. And that just, we would have really appreciated anyone who's in our community who would go ahead and get a flu shot as soon as you can. It's that time of the year, and it's time to get that done if you would. So before I turn this over to our ED that we're going to have, I just wanted to mention that next week we're going to have, I'm sorry, I just wanted to mention that we're going to have some folks from our pain clinic here, and talking about the work that they're doing for patients who suffer with pain and need help. So that'll be next week, and I'm not sure if we're going to do a tour of that, if we'll have them on in this kind of format, or maybe a little bit of both. We'll figure it out between now and then. Hey, until I actually talk with you live next week, thanks for everyone who listens in. We're trying our best to keep you informed of what's going on here at our hospital and in our area. I appreciate all the work that all of you do who are listening to keep yourself and others safe. And until next week, stay safe. And we're going to show you the video from our emergency department tour that happened this morning. So here we go.
Okay, so let me get my thing off here, and we'll kind of just ask you a couple questions. So, the issues. All right, so let's get at it. I just walked through the entrance here. I thought about maybe doing like a car and kind of stumbling out of a car, but okay, I'm not doing the theatrical stuff quite as much. But here I am. I've walked into the lobby of our emergency department. Dan, you want to give a little, just kind of so folks can kind of see what they would see if they were coming in there. There's our lobby. So,
good morning, Dr. Bird.
And I have some folks I want to chat with. Okay, it's Maria, right? Hi, Maria. And Irene. So if I were to come in here and say, I cut my arm, what would y'all do with me? Okay, so let me get my thing off here, and we'll kind of just ask you a couple questions. So what would you do, Maria?
Tell them to walk over to Irene so that she can check them in.
Okay. All right. And by the way, Maria is one of our security folks here. And Irene, Maria basically would say, go over there, right? Okay. So what would you do, Irene?
So, depending, I usually try to get them something to, like a towel or something to cover it up.
Yeah.
And then if it's really bad, then I'm just going to call the nurse and let them know. And then after, I'll try to get them registered and everything.
Okay, all right. So if it's a squirter, you'd probably put your finger on it, wouldn't you?
Yeah.
Okay, so she would take care of it. If you were squirting and things were really, she'd get you all set up. So, all right. Nice talking to both of you. I'm going to keep going here, okay?
You
all
want
right.
to call Maria for us, please, like you would call a triage nurse.
Oh, yeah. Okay, here we go. Hey.
Hello.
Hi, this is Sarah Alvarez Brown, and Sarah is the manager of our emergency department. And I thought she'd be a good person to have with us to kind of take a tour.
Absolutely.
Okay.
So once you checked in with our greeter, we would call the triage nurse, who would come out here and get you back to our triage alcove and start asking you some questions.
Okay.
So we're going to go ahead and go through that process so you can kind of see what it's like. Now, our triage nurses are nurses who have had at least a year's experience in the emergency department and then have had some special training on the triage process. So the triage process is pretty important because it determines who comes back to the ED first. So let's go ahead and go on.
All right, let's do it. Okay. Well, let's see if we can find a triage nurse here.
Oh, I think she beat you.
Well, there she is. Hi, Bree. How are you?
Good. How are you, Dr. Ray?
I'm doing well. I'm doing well. So I'm gonna let Sarah kind of talk you through and how this all works when you're a triage nurse.
So Dr. Bird is our patient today. He's going to hand you his mic so that you can explain the
Yeah,
process.
if I can get this off.
There you go.
I'll hold it.
Oh, okay. Okay, perfect.
Yeah.
Okay, so normally me as the triage nurse will come out, we'll grab the bracelet for the patient once they get checked in with the greeter. I'll call the patient's name, have them come into this area, which we call the triage alcove, and we just do like quick assessment of why are you here today, just kind of down and dirty, the very quick brief details, get vitals, get weight, and then we decide on an appropriate room based on the reason for visit.
Okay. How long does that take usually?
Oh, maybe 5-10 minutes at the most. I would say probably more like 5 though.
Okay. And I see what you have. I see what you have here to kind of check folks over with. You have, of course, things to weigh them.
Yeah.
Yeah. Baby scale.
Yep.
What else do we have over there?
We have just stuff to check the temperature. We've got emesis bags in case somebody's sick, Kleenexes, basically anything you could possibly need. We've got some other stuff in the drawers.
Okay.
Yeah.
All right. Good.
Yeah.
All right. Now, a follow-up question of all this. Do you, like, the triage nurses have to be from Morrison? Is that the deal?
No, it does not have to be that way, although it is. And I feel like the patients already get a feeling of calm once they come into the ER when they, that's a Morrison girl.
That's right. Morrison folks, calm. Yes, that's us. Yeah. Okay. All right.
So one of the newest things that the triage nurses are having to do is decide whether or not the patients are going to be COVID positive or COVID suspect patients. That is something that's decided right here before we ever put you back in a room. The reason for that is because we've dedicated a certain area in the ED for those patients. So Dr. Bird, I don't know what you were a laceration. So you would go into
Well,
a
we
regular.
can change it, I think.
Well, here's
Yeah.
the thing. Even if he was a laceration, but he came back here and told us, oh, by the way, I was diagnosed with COVID a week ago, he would still be treated in the COVID positive area of the ED.
What if I were to say, yeah, I've got this bleeder here, but oh, by the way, I've been coughing. You probably
Right.
would ask that.
Yes, so we actually have a list of questions that we ask patients, whether no matter the reason for visit, and we try to decide, is this somebody that needs to go to that area, even if they are something that just needs some sutures. So we ask them, have you had any new or worsening cough, fever, shortness of breath, sore throat? We ask them if they've been recently tested for the coronavirus, or if they have been around anybody, if they're currently under quarantine. And then if they say yes to any of those questions, we ask for like further depth into that, and then we make the decision, okay, yeah, they probably need to go to that area of the ER.
Sounds good. Sounds good. All right. Well, anything else we need to be asking Bree? I think she's wrapped it up pretty nicely. That's what triage nurses do. They wrap it up in a bow pretty nice and get
And
things
quickly.
moving.
Yes.
That's right. All right. All right. Well, thanks, Bree.
Yeah, thank you.
Good chatting with you.
Thank
All right.
you.
Thank you.
Okay, we're gonna keep on moving here, and so I think what I'm gonna do is Sarah and I are gonna go to maybe some different room types,
Sure.
so we can kind of say what's unique about these rooms based upon if I get triage what they think I need. So let's
Absolutely.
do that.
Here
Okay,
we
so
go.
let's go to what room are we gonna go to first, Sarah?
Well, we're going to try one of our medical rooms here, and
Okay.
I believe it'll be the first room, room number 1.
Okay. Numero uno. Okay, come on in, take a look. All right,
So here in the ED, we have 31 different treatment spaces that we can take care of you in. Some of them are for quick sort of in and out visits, like if you need stitches or if you need to have a wound check real quick. Other rooms, such as this, would be used for like a chest pain workup or perhaps a stroke workup. This is one of our regular medical rooms. You can see that a lot of the equipment is behind the bed, and we have cardiac monitors in all of our rooms as well. What do you think, Dr. Bird?
I think this looks like a typical emergency department room.
It does.
Yeah, I think we're ready to go here. If we had a patient, we can take care of them. Okay, and this would be where I definitely would go. If I had just had a minor cut, I'd probably go to this room.
You would, yep.
Yeah.
As long as you pass that COVID screening, this is where you would go.
Okay, all right. So let's go to another room. Let's take. What are we going to go to next, Sarah? What do you think?
Well, we can go down to our EC area here.
Okay. And by the
Now-
way, hey, while we're walking here, Dana, would you kind of just pan out over the ED to get some sense of the scope of the size of this, or we're gonna? Okay, yeah, come on this way
If
too.
you've never been here, it's quite large, which is nice because then patients aren't really sure how busy we are and
Yeah.
that they're not being disturbed by others.
Yeah.
This is our EC area, which is where we treat our minor ailments.
Okay, so I might go there if I had a.
Depending on how busy we were, you certainly might go there
Okay.
for something simple.
Okay, Sounds good.
And then straight ahead here is one of our trauma rooms.
Okay. Don't want to have to go in here if you're a patient, but if you do, this is the spot, and they do
Now,
good work.
this is the,
Oh, there's an ambulance here coming on in. Boy, they light that up very well with that ambulance, that area. Okay, so let's talk a little bit about this trauma room, Sarah. What's unique to a trauma room?
so as you can tell, the trauma room is quite a bit bigger than our regular medical rooms.
Yeah.
We have things like the overhead lights.
Okay.
We have our trauma supply closet right here next to this room. All of our specialized equipment is going to be kept in that room that we might need to do a trauma.
Okay. All right. Are those carts unique to this room, or those carts?
They are not. So
Okay.
these carts are actually in every room that contain patient care supplies.
Okay.
This prevents the nurse from having to leave the room many times.
Okay. All right. And then, yeah, are you able to see those lights, Dana? Those are really impressive. It's going to really light things up for patients. And we have 2 beds here. So there are times, I know when we have more than one person in here with a trauma or.
Yes, yeah, and it's especially nice if you actually have a family member. So if you and your wife were involved in a trauma, we'd put you both in here so you could kind of stay with each other as well.
And we also have it designed that makes a lot of sense too, because it's the closest to where the ambulance comes in, right?
Yes.
We just saw the ambulance, and so you just come from the ambulance right here into the trauma area.
That's correct.
And off we go. And we have water. Okay. We have water too. What should we go to next, Sarah?
Well, we do have. Okay, now we do have our own X-ray room here in the ED, and that's going to be located right over here.
Should we take a look?
We can. The lights are not lit up, you can tell.
Okay. All right. Ooh, new fancy.
It is. This is something that was added on when we built the new ED in 2015. Prior to that, we did not have our own X-ray room in the ED.
Yeah, I've been in here. Been in here when I had a bike accident a year or so ago. Yeah, so, and this is we have X-ray techs who are available 24/7, 365 to take X-rays for folks who need something done.
That's right. We have dedicated X-ray techs for the ED as well.
And this would be if you're able to stand up or be wheeled over here. If you're if you're in a trauma, they'll have portable machines that come right to you.
That's right. We have 2 portable machines in the ED that we can take into ED rooms.
Yeah. Okay. Good. All right. So let's go take a look at what
we're going to try a behavioral health room.
Okay. Let's do that. That would be interesting to see.
And on our way.
Hey. So we're going to take a look at this room, and then when we're done with that, I'm going to chat a little bit with Dr. Halsey. This is Dr. David Halsey, one of our ED physicians. Hi, Dave.
So our room is actually at the end of the hall. Please feel free to do Dr. Halsey now.
Oh, can I? All right. So here's what I wanted to ask you, Dave. So in terms of, I want to walk through some of this fancy equipment that we have back there and ask you about that. Okay. But matter of fact, let's go walk there and kind of take a look at it. And as we look at it, we'll talk about some of the things you use it for. All right. So let's come on back here. We'll talk with Dr. Halsey. Hello. Okay.
Cutting through the nurses station at this point.
All right.
Coming to our central supply area.
Okay, so Dana's about turning the corner here, and we have a lot of, it's amazing, like since when I started here in 1997, I bet you we had maybe one of these things. But let's talk through, what are these different things here for? Like, what's this right here, Dave?
This is a bedside ultrasound. We use it for a multitude of things. We can use it for trauma patients to take a look at looking for internal bleeding. We can use it for IV access, either a central line or a peripheral line. The nurses use it a lot for starting IVs.
And that's changed a lot too in the last decade or so, where now you can come in and literally, like, you can just take a quick ultrasound of an area like an abdomen and see if there's any bleeding or anything like that, rather than having to send someone to CT every time for that.
Correct. Yeah. We use it a lot, looking at gallbladders, aortas.
Okay. Good. what's some other stuff here? What's this one right here?
This one, I believe, is our
Oh, it says
telepsych computer. If we have a patient that comes in and we need a psychiatric evaluation, we have a service that we use with a psychiatrist who, excuse me a moment. Okay, we're okay. A psychiatrist who can then interview the patient face to face through the computer, give us recommendations on medications or treatments, or if they need to be placed in a hospital for further treatment.
It's kind of interesting because the psychiatric thing, there's not a lot of bells and whistles with it, but at least you have a camera and the psychiatrist who can be anywhere basically and can still do that evaluation. So that's something that we've added here at the hospital in the last, I would say, 5 years, and it's a nice added service for our patients. That's for sure. What's this one?
This one is a bladder scanner. So if somebody comes in feeling like they can't urinate or we're worried that their bladder may be obstructed, the nurses can scan the bladder, looking for how much urine is in the bladder.
Yeah, it's not a problem until it's a problem if your bladder won't empty, that's for sure. What's this one?
This one is a service we have. If we have a patient that comes in with stroke symptoms, first they'll go straight over to CAT scan and get their CAT scan of their head. And while we're doing that, we're loading up this machine, which is a robot with a stroke neurologist that can then face-to-face evaluate the patient. The patient can see them, they can see the patient, they can talk to us to ask, do certain physical testing, and we can coordinate a stroke plan with the neurologist.
Yeah, and I just would add to that, when Dr. Halsey just a moment ago kind of said, wait a second, he's very attuned to the fact that we have what are called stroke alerts here at the hospital. So if someone comes and says, hey, or if the ambulance says, hey, we have someone who we think is having a stroke, they actually call an alert at the hospital telling that someone's coming with a stroke, so we're ready to go, just like you would do with a heart attack.
Right.
Yeah. And we do those alerts also for heart attacks. Yes. We have a fancy name for it, but we have a heart attack alert. And can you kind of walk through on the ED side, if someone came in with what we are concerned is a heart attack, and how you handle that, Dave?
Yeah, if they're coming by ambulance, a lot of times the paramedics will fax us an EKG and they'll notify us that they have what we call a STEMI alert, which is a certain type of heart attack. And we can start activating our cardiac cath lab before the patient even gets here. The cardiologist is aware, they're activated right away. Everything moves really fast. So there's a whole team of people that come in, kind of overwhelm the patient with everything that's going on, from evaluation to IVs to testing.
What's the time frame from when they hit our doors here that we want to have them have that procedure done to open up their blood vessels in their heart?
We want to have it under 90 minutes, and we're pretty good at that.
Let's talk about that stroke process that I mentioned just a minute ago. What are the time frames? What do you do when someone shows up here who's having stroke-like symptoms?
If they're having stroke-like symptoms, time is the key factor. We have up to 4 hours that we can consider giving a drug through the IV, which is a clot-busting medication. So if the patient stays at home for 3.5 hours, we've got a minimal amount of time to work with. So the sooner they have symptoms, they should activate 911 or get to the hospital so we can evaluate that. So we have up to 4 hours to give the clot busting medicine. And we do that in coordination with the telestroke neurologist, and we'll give that medicine and then arrange appropriate placement for them to monitor.
If I remember right, they also, when people show up, we take a quick look at them, but then get them to the CT scanner because we want to see if what kind of stroke they're having. If they're bleeding, then we don't give them clot busting medicine and that type of stuff too.
Right. And they'll go straight to CAT scan from the ambulance before they even come into a room back here. If they walk in through the front door, we'll do a quick brief evaluation and then over to CAT scan.
Do those patients go into a trauma room, or do they go into a general room sometimes?
It depends on how full we are. We like to put them in the trauma or critical care rooms. but, you know, under ideal situations, but sometimes they're in a regular room, but we have the full capabilities to still monitor them and do everything we need to in those rooms. Every room set up with monitoring capabilities.
Good. So we digressed a little bit from our machines, but it was a good digression. So let's talk, what other machines would you say, hey, these are kind of interesting stuff for folks to know that we have?
Well, we have ventilators.
Okay. Say that again.
Sorry, we have ventilators in case you have severe respiratory issues or need extra oxygen. We have those right down here in the ER. And then we have crash carts with defibrillators and all the medications we would need if you're in, say, a cardiac arrest or your heart had stopped.
Let's talk about that too. So that's another thing that we'll hear overhead in the hospital is like an incoming, what we call code blue, which is where someone's had a cardiac arrest out in the field. So how do you guys prepare, and then what's the typical plan with something like that, Dave?
Well, when that alert activates, there is a massive amount of people that come down from lab to respiratory to extra nursing. We go into one of the critical care rooms and start assessing the patient, you know, from the ABCs, the airway, breathing, circulation, and stabilize what needs to be stabilized from the most severe down.
Good. And then I see one other machine I want to ask you about. I don't know if we're going to get to it, but it's like that one right there. I don't know if Dana can get it. Is that the warming machine, or is that the, what is that one going to do? Is that the pump, the blood transfusion machine, or is that the rapid infuser?
This is not the rapid infuser. So this is one of the respiratory machines here.
Okay.
Yeah.
Where the rapid infuser is.
Yeah, let me show me where that's at. I think this is.
So we're going to head into the trauma supply closet that we were talking about earlier when we were in our trauma room.
Okay.
This way into 23.
Okay. Looks like you're trying to run away from me, Kelsey.
This would be one of our trauma critical care rooms. And if you excuse me for a moment, I'll bring out the rapid.
Oh, okay. All right. Good. You know, while we're talking about why Dr. Halsey's getting that, Sarah, I wanted to hit a couple other things. You know, when the patients go through this process, and then we're trying to decide, oh, here we go. Oh, and we're trying to decide whether someone is going to stay or go. Talk through how does that work out in terms of when we decide we're going to discharge someone home versus admit them to the hospital, and what your team does to kind of make that happen once the doctor has made that determination.
So once the doctor has spoken with the hospital doctor and the agreement has been made to keep the patient into the hospital, then we work with the nursing floors upstairs to get them the accurate report to hand off the patient to the medical, surgical, or CCU floor. We're very fortunate here where the nurses from those floors come down to the ED. We get a chance to talk face to face and kind of involve the patient in that handoff process as well.
Okay, good, thanks. And then if they're going to be discharged home, we just have someone go into the room after the doctor's just given the orders.
Yeah, so you'll get discharge papers. Sometimes it can be quite a thick packet because we provide you information with everything that we've done here, as well as any medications we may have prescribed for you. And then we help arrange any transportation needs. So we'll call your family, we'll help you out there. Now, in the times of COVID, it's a little bit different since we don't have any visitors right now. We might also have to involve the physicians in making a phone call to the family and kind of doing the explanation for discharge as well.
Yeah, that's another.
It's an extra step.
Another layer, but
yeah,
that's just what we're having to do. Yeah. Okay, so Dave, tell folks what this is.
This is what we call a rapid infuser. We can infuse blood products at a very quick rate. So if we had a major trauma and they were bleeding internally and we're trying to keep their blood pressure up or infuse more blood, we can infuse it in minutes through this machine. The other thing it's capable of, specifically in trauma, if the patient had a lot of blood volume in their lung cavities and we had put a tube in there, we can drain that out of that tube right back into this machine and infuse it back into the patient.
Okay, yeah. I've seen this in work, and it can be a lifesaver because let's say you have an ulcer that's bleeding, and those things you can literally bleed to death from those. This can get blood back into your system way quicker than a typical IV could do. So it is really, back in the, I mean, even now, but back in the day, what people would do to try to get blood in quicker is they literally would squeeze the blood with their hands, and you just can't do it as well as this machine can do it to get that blood in.
I
So,
believe it can do a pint of blood in 4 minutes.
okay, that's a lot of blood in 4 minutes. So, okay. Dave, I know I'm pulling you away from your duties, but it's been very nice to have you here, kind of give some explanations to folks. Great to talk with you. And any questions that you thought I was going to ask that I didn't ask, that you wanted to answer?
No, I think you covered it. I think you covered it all.
Okay, well, if you think of something while I'm talking, come on by, okay?
Sounds good.
All right, thanks, Dave. Appreciate
Thanks,
it.
Dr.
Yeah,
Hoffman.
yeah. So I think we let's go to that behavioral health
Let's
room.
do it.
Okay, and then we're just about done with our thing. Oh, there's Lori. Hi, Lori. Good. So I'm going to just ask Lori a question or two. Lori, this is Lori Sheridan. She's one of our case manager nurses here in the ED that helps folks out with they're having some issues. Can you give us a thumbnail of what you do for us with us, Lori?
Sorry. I will go and see any patient that maybe needs services outside of the hospital that they don't currently have available to them, or a lot of it is just resources that they maybe don't know about, for medication assistance, Meals on Wheels, help through the senior center as far as its Medicare open enrollment now, reminding them they can redo their benefits. But it's a lot of that information, or just educating them about what's available within our hospital, outside our hospital, also helping them get primary care providers if they don't have one assigned to them throughout the community. We can get them established through our clinic. So that's a lot of what I do.
Yeah, good. Thanks, Lori. I wish I needed to be another about 5 or 6 inches taller and longer arms to really do that well, but I hope folks heard you. Great. Lori does a great job for folks. Thanks, Lori. Hey, Jean. Hi there. You didn't think I was going to talk with you today, did you? So Jean, tell me what you do down here.
Well, I'm an EKG tech, and so basically what I do is EKGs. I get paged and I go to whatever room I've been paged to do and do an EKG on that person. And then I get a previous EKG and give the one that I did with the previous to the doctor so he can see if there's any changes from the previous time to today. And basically that's what our job is doing EKGs throughout the hospital.
And you get to just kind of relax and just lollygag your way into that room to get that EKG done if the patient's having chest pain, don't you?
No, that's not true. We have a set limit of time, like 7 minutes. So we're hustling. We're not wasting any time. We're going from room to room. I could be in a room doing an EKG and get paged for another 1 or 2 while I'm doing that one. So I let them know I'll get there as quick as I can. If I can't, if I have a co-worker, I will page that worker to, help me out so we can try to meet those times that we're supposed to meet.
And Jean, you do a really good job with that. But our goal is 10 minutes. And Nicole here, hey, pan over to Nicole. Hi, Nicole. Nicole does the same thing, don't you, Nicole? Yeah, I know. Nicole doesn't have a microphone on her, but and Nicole also, I don't know if you do this as well, Jean, but Nicole does work with, if you need a Holter monitor or an event monitor, both of you, okay. Yeah, they'll help to set you up with that as well. So, yep, these are your Holter and event monitor friends in the ED. Thanks, ladies. All right, okay, we digressed once again, but let's go into one of these behavioral health rooms. Okay. All right, Sarah, so
Okay, so this looks a lot like the other room, right?
Yeah,
It looks
it
a lot
does.
like a regular
it
medical
does. You may
room.
want to get over this area too eventually, Dana.
Here's what we will do for the behavioral health patient. Now, the TVs are obviously ensconced in this plexiglass, so you can't break that.
That's a
Everything
nice
in here,
word,
except for the
ensconced.
cart,
Yes.
goes. We take everything out of this room.
Okay.
Now, I don't know if you can quite tell, I'm very short, so I can't reach it, but this is a garage door. So if we have a behavioral health patient that we have concerns that might be in danger of hurting themselves, We will actually lower this garage door, so everything that's behind here will be out of reach.
Okay. Yeah, so in other words, and you can open the door if your staff needs to do something while they're in the room with the patient, but otherwise,
That's right.
if they're in here for a while by themselves, at least it keeps them safe.
That's correct.
Yeah.
These rooms also do have the ability to be monitored. There are cameras in these rooms.
Okay.
However, they can be turned off if we happen to use it as a medical room. So they're up in the corner there, and they do not record. They're only for us to watch those patients who might be in danger of harming themselves.
Yeah. Yeah. Good. So I think that's the main room, and then.
Now I'd like to show you the COVID area.
Oh, perfect. Yeah, we've got to do that for sure. So, come on, Dana. Keep her moving, huh? Keep the. All right. All right. Yeah, this is an area that we didn't have. I don't know, 8 months, 9 months ago.
Right.
Yeah. I wish we didn't have it now, but we do, and we need it.
Okay, let's stop here.
Okay.
All right, so this bunch of rooms back here in the ED are used to treat COVID patients and PUI patients, which stands for person under investigation. So it would be somebody who has COVID-like symptoms. A couple of things I want to point out to you in this area. You'll see that cart down here.
Which
That's
one?
our
This one right here?
isolation cart. Yep, that's
Okay.
the one.
Okay.
It's our isolation cart, which contains all of our PPE. Here at CGH, we're very fortunate that we're using a lot of reusable PPE. So our staff gets to hang on to their PPE and use it over and over and over
Now,
again.
this isn't all the PPE that we have for the hospital.
That's correct.
We have a lot more than that, but yeah, that's for this unit area.
I think we have 4 more carts on the other side
Oh,
of
yeah.
the unit alone.
Yeah,
So,
We use a lot of it. Yeah.
yes. And then here also is an
Oh, yeah.
ultraviolet cleaning machine.
Oh yeah. That's a good one to point out. So how long? I think it's 20 minutes that is in a room after someone cleans it up. And
That's right. So yeah, so when our patients leave and we need to clean the room back here, we'll put that in a room, very bright purple ultraviolet light to disinfect the room.
And that's not a new thing with COVID. That we've had that for quite a while.
We have
and
had that for a while, yes.
Yeah. Just another layer of protection for folks.
That's right.
Yeah. Speaking of which, I haven't seen any of our environmental services staff around. They're probably hiding from me.
Well, we're very fortunate in the ED that we have dedicated EVS staff here.
Okay.
So they just work in the ED when they are on shift. They are around. We saw them actually
I
earlier
know,
on.
we did. I should have grabbed them then. So, like, let's say just in this COVID area,
Yes.
when our person under investigation area, I should say, when someone is evaluated, and let's say we say, okay, I think either you have it, or you're at least not sick enough that you have to. Anyone who's in here and then leaves that room, what's the cleaning process to get that room ready for the next person to come in, Sarah?
So we rely on CDC guidelines for how we take care of the rooms after the patients leave. And it doesn't matter if they're admitted or if they go home, we do the same thing. So the room will actually stay empty for 30 minutes and allow kind of everything to settle. At that time, the housekeepers will go in, they will clean the room completely, and then they will do the disinfectant UV procedure. So it can take about an hour, hour and a half to turn a room over after a patient leaves, which is why we've got many rooms to be able to use.
Yeah. So it's just definitely a longer process. Does the UV light thing play in on when patients change over rooms, or is that just here and there that we're using them?
No, for this area back here, it's used.
Every time. Okay. Yeah. So for those folks who are coming in, just to know that that's our process. And for a regular room, a trauma room, there's still every time that someone is leaving there, it's getting cleaned.
It is getting cleaned.
They're not sitting for
once a
90
day.
minutes or.
Yeah.
Right. Okay. Good. I was hoping we could chat with registration. I see Wendy.
Yes, Wendy's right over
I
there.
kind of want to talk everyone through, like when someone shows up and they need.
You know what? She actually is just heading into a patient room.
Okay. So Sarah and I, we're gonna come down here and see if we can say hi to someone who does registration work. Hey there. Good. You know what? I'm going to do this differently. I'm not going to try to reach over. I'm going to go around here. Okay. All right. Because I'm just not tall enough. Hi, Wendy. Stand up for us. So, Wendy, you're one of our registration team. Okay. So, tell me how, when someone shows up to ED, where do you show up to help them out?
Well, first of all, the greeter out front, they put the patient in and it prints out our paperwork. So we go back to our computer and make our chart and wait for them to put them in a room, and then we go and verify their information and get them all checked in.
Okay. So yeah, we just kind of make sure we get you checked in terms of you're here, you're billing and all that kind of stuff. Now, how does that work with our COVID area, Wendy?
If they're able to talk to us, we call them on our phone, talk to them through or through the door. If we have to, the nurses will go in and put information up on the door for us.
And the other thing, if someone has a trauma, obviously that what you're doing waits until we get things figured out in terms of getting them stabilized and all that kind of stuff, I'm sure.
Absolutely. And if we're not able to talk to the patient, we wait till family members are available out in the lobby and we're able to take them into a private room and talk to them from there.
Okay, great. And one other thing, hey, Sarah, would you have him, Dr. Halsey, if you could, just wait with that outfit on so we can take a look at that. So one other thing I just wanted to ask you, Wendy, when this is new, this is relatively new with this new ED, it used to be registration was out front. So now you're able to patients can come back here and you can take care of that while they're in the rooms getting taken care of.
Exactly.
Yeah. So that's a new wrinkle. And I think that's nice for patients. They appreciate being back here instead of having to wait out in the lobby to get that taken care of.
Right.
Good. Wendy, you didn't know I was going to be chatting with you today, but you did a good job and it was good chatting with you and good work. All right. Thanks, Wendy. Yeah, you too. Okay. So let's go. Is Dr. Halsey okay with us? Okay. I want to just show you Dr. Halsey has his PPE and I wanted us just to kind of take a look at.
You can see one of our respiratory tests.
Yeah.
Dr. Halsey.
Yeah. He's getting gowned up, but I just wanted to you can see what one of these full PPE looks like. Yeah, and Dr. Halsey's like me. When I put mine on, I have no chance of trying to tie that back one right. I can get the top one, but that one just.
It's often a two-person ordeal.
Yeah. Okay. And I don't want him to break him out of his normal rhythm with how he does this with patients. So, okay. So I just wanted. So Dave has on his. This is his respirator, which obviously is very key because you just particles can't get through to that. And then he has on his eyeglasses and then something over his head. And Dave, just talk to me so I can kind of hear the Darth Vader sound.
Luke, I am your father.
Yeah, so it definitely it definitely changes your voice. I didn't mean to keep you, Dave, but I wanted folks to be able to see this is kind of when someone comes into the room, our staff, every time they go into one of these rooms, this is what they do so that they can be safe and make sure that they can take good care of people, but at the same time be safe themselves. So I wanted everybody to see that. Thanks, Dave. Appreciate it. Yeah. Okay. So Sarah, I'm trying to think if there's anything else that you and I were thinking we were going to cover here today.
I cannot think of anything else. I think we were fortunate enough to hit everything that we needed to hit. And
Okay.
I would say if anybody has any questions, please feel free to put them in the Facebook Live comment section. We'll get back to you, even though we can't do it live today.
Yeah.
Definitely get back to you. Dr. Halsey touched on this briefly, but there are a lot of conditions that can happen to a person that are very time sensitive. So we've kind of taken the time to show you the ED, hoping that if you feel like you're suffering from a heart attack or a stroke or one of those time sensitive conditions, that you come in. The sooner you come in, the better. Please do not delay your care.
Yeah.
Square footage and how you.
Oh, yeah. I think Sarah mentioned there's 31 rooms. Or
There
Dr. Halsey.
are 31 treatment areas, 24 rooms.
Yeah.
So that little treatment section that we had had 6 chairs in it. We can
Yeah.
use that as well.
Yeah. It's interesting that we designed to have a lobby, but we don't use it a whole lot because most folks are
We're very fortunate.
able to have most of them come back here. And yeah, but I think Sarah's point, I'll double down on that. If you're having chest pain, if you're having stroke-like symptoms, you're having what you think is an emergency, we have an emergency room here. We do really good work for patients. The team here does a fabulous job. And when you come here, we're gonna make sure that you're safe during that process, even with all this COVID going on.
Yeah, we've been doing it from the beginning. So we're about 6, 7, 8, 9 months in. We've got our processes down.
Yeah, good. Sarah, hey, thanks a lot. It's been good
Absolutely.
doing this. I think it's been I know it's been very informative for me, and I hope for those who are watching this. So yeah, thanks, and bye, everybody.
Bye.